Today we are talking about wicked problems that affect the Canadian healthcare system. What is a wicked problem? A wicked problem is an issue facing society that has no clear solution. These problems are often interconnected with other problems, making the solution very complex. Sometimes the solutions to wicked problems create unintended consequences, and sometimes the solutions simply help further define the problem. There is no quick fix to wicked problems. The wicked problem we are focusing on today is the barriers that individuals with mental health conditions face when trying to find employment. Mental health is defined by the World Health Organization as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and can make a contribution to his or her community. People who suffer from mental illness struggle to cope with everyday stresses and are often unable to maintain steady employment. People living with mental illness are often excluded from social and economic activities and are much more likely to descend into poverty. Mental health conditions are associated with the highest rates of unemployment, with rates between 70 to 90%. Some prevalent factors that prevent individuals with mental illness from obtaining employment are discrimination, lack of education, and lack of housing. Let's take a closer look at these barriers. Discrimination. In many cases, mental illness is viewed as a personal weakness and is associated with laziness or being unpredictable and violent. This isolates individuals with mental illness and prevents them from asking for help. Stigma surrounding mental illness can influence employers if they have a negative perception of mental illness. Although employers cannot legally discriminate an employee on the basis of their mental health, negative stigma is prevalent and often prevents individuals with mental health conditions from obtaining employment. Lack of education. Education is well recognized as an essential part of development. Individuals with mental illness often face barriers to education and have poor educational outcomes. Because of this, many individuals with mental health conditions lack skills necessary for employment, such as time management, literacy, and social skills. There is a strong correlation between low levels of education and low-wage employment. Lack of housing. Creating access to affordable housing has long been a goal of mental health care, as stable housing has a positive influence on recovery and promotes dignity. However, the average wait time to get access to housing in 2014 was 311 days. Individuals with mental health conditions often end up living in shelters or on the street. There is a need for quality housing that is affordable and available. Lack of housing adds to the social isolation and stress that people with mental illness already struggle with. So what are our options? Option 1. Implement campaigns to create awareness about mental health issues and reduce stigma within the workplace. Option 2. Implement programs within public schools to provide early intervention for children struggling with mental illness. And option 3. Implement the Housing First model to increase access to affordable housing by reducing restrictions and promoting learning of life skills. Our recommendation is to focus on early intervention. Using an upstream approach to help individuals develop skills earlier in life can be beneficial for those living with mental illness. Through early intervention, children with mental illness can achieve higher levels of education and increase their chances of obtaining stable employment in adulthood. Although wicked problems cannot be easily solved, there are several options that can potentially make a difference. Thank you for watching!
Please, I don't like laughing.
Oh my god, this is the hardest thing I've ever had to do in my life.